Welcome to the series Vitamins for Whole Health, short lessons on the vitamins that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about vitamin K. Vitamin K comes in several forms, all fat soluble, meaning they mix well in fat and not in water. The first form, called vitamin K1, is the form that is most often meant when vitamin K is discussed with no distinctions. Its chemical name is phylloquinone, and it is sourced from plants. I'll say more about that later. The second form is a family of molecules appropriately grouped under the term vitamin K2. Their chemical name is menaquinones, and they are sourced from animals and bacteria, which convert the vitamin K1 in plants into its K2 form. Vitamin K is used by the body to create several vital proteins. These vitamin K dependent proteins include prothrombin, which is necessary for the activation of your clotting cascade, which keeps you from bleeding out from external cuts or punctures, or internal hemorrhages, and osteocalcin, which is involved in placing calcium inside of your bone matrices. Vitamin K also activates your matrix GLA proteins, which are used to transport calcium ions from your soft tissues, such as veins and arteries where hardening is harmful, into your bones, where hardening is useful for placement by osteocalcin. While both vitamin K1 and vitamin K2 do share some overlap in terms of functionality, they also each have their strengths in different domains. Simplistically speaking, it's sensible to think in terms of vitamin K1 being more of the clotting specialist, while vitamin K2 is the circulatory and bone health side of the house. In fact, in Japan, they currently use one form of menaquinone under the brand name menaquinone in pharmacological doses for the treatment of osteoporosis. Meanwhile, American companies are seeking permission from the FDA to make similar treatment claims on our shores. A deficiency in vitamin K is rare due to the body's ability to recycle vitamin K and keep using it for a long time. But under certain conditions, a deficiency is possible. This can manifest in the inability of the blood to clot efficiently, such that it leads to excess bleeding or, again, hemorrhage. Over time, without vitamin K's bone supportive benefits, osteopenia and osteoporosis can also occur. Vitamin K deficiency risk rises in the following groups: pregnant or breastfeeding women who may need more of the vitamin, those on high doses of vitamin A, which can block absorption of vitamin K. Now, high dose vitamin E is an issue as well, but rather than blocking the absorption of vitamin K, it blocks the activity of it within the body. Again, when vitamin E is taken in high amounts. Those with malabsorptive conditions such as cystic fibrosis or chronic pancreatitis or cases of liver disease can also be at risk. And of course, those on certain classes of drugs, which you can see listed here. And no, it's not just the blood-thinning vitamin K antagonists that make the list. Vitamin K does not at this time have a recommended dietary allowance associated with it. The adequate intake has been designated as 120 micrograms per day for men and 90 micrograms per day for women. However, many experts are now saying that this is too low and does not account for losses during pregnancy and breastfeeding, so we may see this change at some point. Good sources of vitamin K are as follows, with the green leafy vegetables making up the vitamin K1 list on the left. Do you know why the list on the right specifies grass-fed for foods of animal origin? This goes back to what I said right at the beginning. Vitamin K2 is made from vitamin K1, either by bacteria, as you see with natto, or by animals, as you see on the rest of this list. In other words, the raw materials, the K1, must first come from somewhere, meaning that the animals in question have to be eating their leafy greens in order to produce vitamin K2. Putting aside the issue of getting too much vitamin K while on blood thinners like Coumadin and warfarin, which obviously creates problems by overwhelming the medicine's ability to antagonize vitamin K and thus slow down clotting, there are no reported toxicities for vitamin K in adults. It turns out that the body is pretty good at breaking down and excreting the excess even as it recycles and maintains a reservoir to protect against deficiency. Now, children are a different story, as it has been proven that the vitamin K shot given in American hospitals at birth greatly increases the risk of the infant developing hyperbilirubinemia or jaundice in the days following birth. This is, of course, given to infants in order to protect against hemorrhage in babies born with low vitamin K levels, as studies have shown that vitamin K does not pass to the infant in appreciable amounts in the breast milk. However, these studies were conducted using maternal intake of vitamin K1, while more recent studies indicate that maternal intake of vitamin K2 may result in a more appreciable bump in the vitamin's presence within breast milk. More studies will need to be done to evaluate these results and determine whether maternal intake of vitamin K2 is a safe substitute for K1 injection at birth. Thank you for viewing the vitamin K entry in the series Vitamins for Whole Health. We'll see you around.